Washington is still assessing what went wrong last week after a last-minute decision to pull the GOP healthcare bill from a House floor vote.
WENY's Isabel Garcia sat down with our political analyst to talk about the state of healthcare and what the bill's failure means for states.
With Obamacare remaining in place for now, Elmira College political science professor Dr. Jim Twombly weighs in on what exactly this means for healthcare coverage for states and why he thinks that this legislation did in fact fail.
The shocking decision to pull the healthcare bill from an expected vote on Friday came after House Speaker Paul Ryan advised President Trump they would not have enough support to pass it. Dr. Twombly believes the blame game is not necessarily specific to one person.
I don't think you can point any blame at the Democrats on this because they said from the outset it's not us, and they're not the majority party. They don't control either chamber of Congress. They don't control the presidency. If the blame is anywhere, it's within the Republican Party, and you can pick whoever.
In terms of what went wrong, Dr. Twombly credits steadfast partisan politics without any sort of middle meeting ground as to why an agreement could not be made.
When you don't govern from the center, you create these problems where a small ideological group within the party can hijack the party or hold it hostage or hold any particular piece of legislation hostage.
Moving forward, healthcare may no longer be a repeal and replace effort, but rather focused on repair.
Some Democrats are talking about maybe trying to reach across the aisle to moderate Republicans and trying to find a way to fix the problems that exist with Obamacare. In some states and in many counties across the country, we've gotten down to a single provider, which means costs go up.
According to Dr. Twombly, federal funding for states which took on Medicaid expansion through Obamacare, including New York, is safe for now.
This now means that the federal government money is still there for them. Obviously, if that goes away down the road, states are going to have to change how they fund Medicare.
Dr. Twombly says Republicans will now most likely move on to tax reform. For now, reporting in Elmira, Isabel Garcia, WENY News.